One of the main goals for helping people with psychosis is to identify and help them as early as possible. So ideally we do this when someone's in a clinical high-risk state, where they don't have a diagnosis, but we know they're quite likely to become more unwell if we don't give them support soon. But identifying people at clinical high risk for psychosis can be challenging. A recent study I worked on aimed to compare symptoms of clinical high risk using self-assessment tools rather than interviews with mental health professionals to look at whether there are different risk levels and age group differences using these measures. We recruited over 900 people from France and the UK and explored how different clinical high risk symptoms are connected and which ones are the most important. Key symptoms were different depending on the measures that we used. So one highlighted that hearing voices or whispers was the main risk-related experience, but the other found that being distracted by non-relevant thoughts was the most important. But overall, there were no differences between the two scales in terms of predicting clinical high risk in our participants. So overall, we identified some key symptoms of clinical risk for psychosis, which are consistent across tools, risk levels and ages, and this is really important for patient care. We also identified that there might be some key symptoms missing in clinical high-risk criteria, so understanding what these are could help better improve early detection and improve prevention and support strategies for people who are having these experiences.